Okay. Good afternoon, everybody, and welcome to, this is our first CHF Talks webinar for 2022. So welcome. It's probably a bit too late to say Happy New Year, but I hope everyone is faring very well. I'm Leanne Wells. I'm the CEO of the Consumers Forum of Australia, and I'd like to welcome you. Before we begin today, I'd like to acknowledge the traditional owners of the lands wherever you are watching this webinar from today. I pay my respects to elders past, present and those emerging. I'm on Ngunnawal country here in the ACT. So today's webinar topic is focused on consumer assessors and their role in improving healthcare service and outcomes. So a topic very close to all of our hearts, health service improvement and quality. Our presenters today, we've got a very interesting and highly qualified panel for you to hear from today. We've got Karen Luxford, Lena Lowe and Karen Edwards from the Australian Council of Healthcare. It's on healthcare standards, isn't it? Not of. Australian Council of Healthcare Standards. And we're also joined by Ros Chataway, who is a member of the CHF board, but are currently serving Assessor, Consumer Assessor on health accreditation assessment teams, and Mark Diamond, who has also served, and I think is still currently serving in that role, Mark, as an assessor. Yeah, so we've got two people who arguably wear a consumer hat as part of, who are currently serving as consumers, to share their insights with you today. So in today's presentation, we'll hear firstly about the role of the council and the health service organisation assessment process. Then we'll have a conversation with the panellists and hear from them about the gaps and opportunities that we can all work together on towards navigating the assessment and accreditation process. And then with a conversation really around the additional value or insights that consumer assessors can bring to the overall assessment team as we look to improve healthcare system improvements and service outcome improvements. So just a few housekeeping matters before we get going. The webinar is being recorded and that will be available on the CHF website along with some additional resources following today's discussion. We'll respond to questions at the end of the webinar, those that we don't get to, but please feel free to place questions or comments that you have as we go along through the course of the conversation today in the Q&A box, and we will pull those out and put them to the panellists as we go along. And we'll make answers available to those questions that we don't get to on the website with webinar recording as well. So without any further ado, I would like to hand over to Karen and her team to talk to us about what the ACHS does, what is accreditation, and to help us understand the roles and responsibility of assessors. Karen and team.
Thank you very much, Leanne. Can you hear me? Great, thanks everybody. And thanks for this opportunity to be able to work in partnership with the Consumers Health Forum of Australia. We've got a long relationship, which we value very much, and it's a great opportunity for us to be able to talk about this topic today. Unfortunately, Karen Edwards from my team won't be here because she's actually assessing at the moment. So, but Lena Lowe is also here to provide some information about assessment and consumer assessors. So I'm just going to start out by giving a little bit of background around. Some of you may not know the Australian Council on Healthcare Standards. We've been around for many decades and were established in the mid-70s. So we're the longest established accrediting agency in Australia. And I'm also Group CEO of our international company. So we do work in 15 countries overseas. We were established by the stakeholders. So we very much have on our council the representation of the voice of private health services, public health services, consumers, government, and a range of peak industry bodies. And I'm pleased to say that Ros Chataway is actually a councillor with us as well. And so I acknowledge Ros today. We are governed by a board of directors that is partly elected, partly appointed. And we have a range of accreditation programs that we provide in a number of different health service areas. We are ourselves authorised by the Australian Commission on Safety and Quality in Healthcare, which is the government agency, to be an accrediting agency within Australia. And we regularly consult with a whole range of other countries about what is happening in terms of accreditation and where is it heading internationally. We were established by the AMA and by the forerunner of AHHA. We are an independent, not-for-profit organisation, so we don't receive government funding. And our vision is to inspire excellence in healthcare, and that is what we're really committed to. And the exciting thing for us is the assessment opportunity is an opportunity to support quality improvement, how that goes forward in keeping our community safe through having the right sorts of standards in place. I have a fabulous executive team, and Lena is here with us today, but also Linda O'Connor and Michael Giuliano in our international business. We're based in Sydney, and this is our office in Ultimo, but we also have an office in the Middle East in Dubai, and we also have a presence in Hong Kong through our international business. And we, in turn, are accredited. So we talk to health services about the fact that we get a spotlight shined on us, an external pair of eyes, actually looking at us internationally through the International Society for Quality in Healthcare and their external evaluation program. So we're pleased to have been assessed over many years to make sure that we are up to the standards as well. And we just had our own assessment recently. The report is not official yet, but we were extremely excited to have what we think will be flying colours and no recommendations. So we'll wait to see if it pans out in the final report. As the CEO coming in the last couple of years, I've been very keen to see how we can position ourselves to make sure we support our members even more than we have been, and that the member benefits and experience is positive for our health services. So that's hospitals, community services, drug and alcohol, justice health, oral health, a whole range of different types of health services. And this is our strategy on a page for going forward, being focused around that member experience, diversifying what we're doing, demonstrating our leadership and innovation, which we're very excited about, and improving our internal capability. So in terms of our offerings, accreditation services are the main part of the work that we do. We accredit against the Australian Commission standards, as I said, in Australia, but we also have our own standards that we have developed over many years, which is the EQUIP program, and that's used in some other services and internationally. We believe performance data is really critical, so we have a performance outcomes service and clinical indicators. We've got the biggest clinical indicator program in the world, and so we have indicators for health services to measure their performance against. We provide consultancy, and we also have an improvement academy which works with our members on the improvement area. So as Leanne said, what is accreditation? So the most important part about accreditation is having that independent external assessment by peers against a set of performance standards. So in the Australian setting, largely the national standards, which are developed by the government through the Australian Commission. But it's also for health services a public recognition of the achievement that they have attained and assurance to the public that the standards have been met. We see it as an opportunity for continuous improvement, and that's how we work with health services, painting it as an opportunity to improve on an ongoing basis and promoting safety and quality. One point that is worth making is that accreditation is a snapshot at a particular time. And so having that regular review process is important. ACHS developed the short notice assessment program in Australia, which is now adopted nationwide. And we know that the Australian Commission is going to be recommending moving to what they may call unannounced or short notice for everybody for all health services in the next 12 months. So having that peer review is very important, making sure that health services implement what are called actions or elements within the standards. So those are the recommendations in the standards. Evaluating, undertaking that self-evaluation is one of the initial steps, and then addressing the gaps that are identified. At the moment, if you're in the mainstream program, you'll be having an on-site assessment as a health service every 3 years. If you're in the short notice process, it's more frequent and but not the full set of standards. And then the service focused on implementing the recommendations. So our assessors are very diverse. They come from a whole range of different backgrounds. Lena will tell you a bit more about what's involved in assessing later on, but we see that role as an important team member, as an opportunity for improvement, as an educator, as an ambassador. Our assessors are a very important face for us in the community and in our health services, and as being change champions. So the roles and responsibilities of assessors are to do that independent assessment, but in a team environment. That's most important to note. You're not on your own. To assess supported with evidence, so really looking at what the health service has in place in terms of policies and procedures. Acknowledging the strengths, always important to have positive feedback, and identifying those opportunities for improvement. Recommendations are included in the report that comes back from our assessor team, organised by lead assessors, and we provide advice on how to improve, and that's really important for the organisation. So I will stop there, because I know we have other opportunities later in the program for Lena to provide some more detail for consumer assessors.
Thanks very much, Karen. So we'll go to some open discussion now, and I'd like to firstly bring in Ros and Mark as current members of assessment teams, and to ask you, from your perspective, what experience do you think consumers bring to assessment teams?
I'm happy to kick off if you like, Mark. I think, as we've seen with the number of different people joining online, that it's really important to have consumers from across the whole of Australia, not just consumers that are in the metropolitan area. So it's great to have consumers from country, rural, remote, smaller hospitals, larger hospitals, regional hospitals, community. So I think consumers in every facet of their lives bring a lot of lived experience to look at healthcare organisations with just a different lens and a different viewpoint. So I think personally, there's not a one-size-fits-all process. in healthcare organisations. So it's great to have consumers from all walks of life, not just medical, not just nursing, not just allied health, from lots of different kinds of backgrounds, to make sure that, you know, when we do assessments, that we capture a lot of different information, not just nursing information, nursing information, nursing information. And it's important to have the consumer voice listened to from across this myriad of different backgrounds of consumers.
Mark.
Yeah, thanks, Leanne. Look, I'd echo exactly what Ros has said. I think the value, the inherent value here is to have people that have certainly have lived experience, but it's experience of the experience of care, as well as the outcome of care, that people can, consumer assessors can bring to the assessment process and add value to the team. So I think the idea of the experience of care having an equal importance as the outcome of whatever the health intervention has been is an important consideration. It's not just a, if you like, a sort of a soft requirement anymore. It's actually embedded in Standard 2 of the Australian Quality and Safety Standards. In aged care, it's actually embedded across all the 8 standards. In fact, in each of them in the aged care assessment process, and I know that's not what we're talking about today, however, there's actually a consumer expectation requirement, as well as a statement of commitment by the organisation, by the service provider, as to how they're going to meet that requirement. And that's a deliverable against each of the 8 standards in aged care. So I think in health, it's certainly represented strongly in Standard 2. In partnering with consumers is what it's all about. But if you actually look at the other standards as well and have this lens applied that Ros just referred to, about the lived experience, the actual experience of care, as well as the clinical outcome, you'll have that lens quite legitimately being applied across all of the quality and safety standards. And that's what a consumer assessor can bring to the table.
And can I just add, Leanne, that I mean, I have had experience as a healthcare manager and I've run safety and quality units. But I would have to say, as a patient advocate for my mum, you know, with palliative emphysema, that I can say without a shadow of a doubt that with my lived experience, you know, looking after her and taking her to appointments and her admission time in hospital, that provided me the greatest amount of insight and learnings than any of my time as a safety and quality manager, because what I had thought was happening within healthcare organisations is not always necessarily happening in healthcare organisations. So it's the consumer at the coalface that's actually seeing what's happening, that is able to then, you know, report back on, you know, the realities in the healthcare setting as well.
Yeah. And just a key message I picked up there from what you're both saying too is, and Karen's introduction as well, that assessment teams, accreditation teams look at whole of organisation, and it's a misconception to think that someone involved like yourselves wearing a consumer accreditor hat, you're not just looking at, you know, Standard 2, very important standard, now mandatory, not a developmental standard. You are, like other members of the team, looking at all of the other standards, you know, the governance and the clinical governance standards, the new one around health literacy, and again, there's particularly unique insights you can bring to that. I'll come back to our panel in a minute, but I've got some questions I wanted to pick up here. This is probably one for you, Karen or Lena. Can you explain the difference between the ACHS and the Accreditation Councils under APRA, the national law?
Yeah, yes, thanks very much for that. So APRA is concerned with individual healthcare practitioners. So their accreditation relates to the ability for a clinical professional to practice, and what we're looking at is health services. So they are quite different, but both are very equally important.
Thank you. Just to the anonymous attendee who's asking about the provision of more information about the next assessor competency training program. I think you'll be touching on that, won't you, in your, so we'll be getting to that shortly in the webinar today. Comment there about it's great the bush gets to talk about how we're going out here. Absolutely. Now there's a comment here. I'll just read it out, and you may wish to make a comment as a panel, or we just take this as a comment. Accreditation is a great opportunity. Every accreditation period, the hospital goes into overdrive. Many programs are cancelled during that time while all staff tidy up paperwork. I met 2 excellent accreditors and kept in touch with one of them. It would be very helpful for assessors to share best practices that they see in their work. I was told that they cannot share information from other sites. I would like to see much more collaboration. For me, it is heartbreaking to witness that mental health care is languishing in outdated treatments. Assessors should be useful in sharing best practices. Maybe a reflection on that, because I think what they're driving at is obviously your accreditation teams. Each service is different. They have their own personalities and challenges. To what extent does ACHS facilitate a knowledge exchange, I suppose, or a community of practice across assessors?
I'll ask Lena to comment as well. I think it's a fantastic question. And I think the comment on that sort of flurry of activity every 3 years is, what we're trying to look at. How do you stop that? Because, safety and quality is every day. It's not a 3-year thing. And we want it to be part of business as usual. So there are, changes, as I said, planned in terms of what the national scheme will look like. But also at ACHS, we're really excited to be involved in projects and innovations that are looking at things like the use of performance data. How do you use the data that's available in the system to be able to get a picture of safety and quality without increasing that burden on the healthcare services themselves. And so in sharing experience, I think certainly I get a lot of feedback that our assessors do share experience. They may not do it in a named way. They may not say you should be doing what service X down the road is doing, but they do provide ideas and they do provide suggestions and strategies. And I know, and Ros, I'm sure will have firsthand experience, and Mark as well, that's where the gems are. That's certainly what the healthcare services tell to us is the benefit they find of being assessed. But I'll let others comment.
Yeah, I'm happy to comment on that. I did an assessment probably about a month ago, and I was asked specifically by a group under this particular standard. They were languishing a little bit, and they just asked me some generalised questions about, which health services have been doing really well. And I sort of pointed them towards a couple of different states and, where I had seen examples of this particular standard done extremely well. And so they were going to go off and do some of their own research, as well as I pointed them to the ACHS website, where they can actually see every year we have the awards ceremony, and they can actually see what kind of projects have actually been undertaken by, hospitals from across Australia. And under one of those headings, they could actually see the answer to one of the problems that they had been experiencing. So they told me before I'd left on the Friday that they'd made contact with that particular organisation, and they were going to set up a couple of Zoom meetings. So, that was very rewarding.
Yeah. Any thoughts or comments from you, Mark, on knowledge exchange and best practices being shared across members of accreditation teams?
Yeah, well, look, I think this is, by the way, you asked whether I was still surveying. I'm actually not surveying with ACHS. I finished up about 12 months ago. So just to clear that. Yeah. But look, mate, I certainly was for 6 or 7 years primarily with a focus around regional and rural services, but not only, also some of the major teaching hospitals as well. Look, one of the benefits of the way ACHS is a bit of a rap for ACHS. One of the benefits of how they do the accreditation process, so how they administer the sort of assessment against the standards, is that you do have a multidisciplinary team of assessors, and multidisciplinary meaning not just by profession, but in this case by experience. And that's the essential ingredient here. And the sharing of ideas amongst a team of, for a teaching hospital, you might have 10, 12, even 15 assessors. The pool of knowledge that is accessible there at the point of assessment with an individual service is enormous. And the sharing of that, about ideas about what works and what doesn't, the whole ethos being around service improvement rather than what I would suggest is a more punitive approach in terms of regulatory compliance, which is not the application here, is in aged care, but not here. I think that is a sort of a forerunner to, being able to freely share those experiences within the team and with the service that you're associating with at that time. So I just think it's a great model.
Yeah.
Can I just add as well that, I know there's always a flurry of work being undertaken before an assessment occurs, and I've experienced that, as a safety and quality manager, and I know that it is an incredible amount of work, which is why I like the idea of moving towards the SNAP, because it should just be business as usual every single day, so that when assessors come in, they can just see, this is what we always do. So it's not that stress on the staff. That being said, when I do go into organisations that have been given 3 months notice that they have coming up to an assessment, I don't go in there and, I go in there with just, tell me the great things that you've been doing. That's always a really good starting point for people, because they're already stressed out having 10 to 15 assessors walk into their organisation. So you have to sort of just, try and calm the whole situation down kind of thing by just making it a pleasant experience. We're not here with a big stick. I much prefer the carrot. So I always start off with the questions about, tell me the great things that you're doing in pressure injury, or tell me the great things you've been doing with, involving consumers in their care. And people just light up and they want to tell you the fantastic things that they're doing, because everyone goes to work from whatever discipline to actually help patients, consumers, their family, their carers. Yeah. They don't go to work to for bad things to happen. So they're really happy to open up and tell you the wonderful things that they've been doing. Yeah. And whilst they're doing that, then you can start, digging down into some of the more data
probing areas for improvement. Yeah,
that's right. But it's always important to make sure that you have the positives. You really want to elicit the positives.
Yeah, thanks both you, Ros and Mark. And I think just to acknowledge the ACHS's leadership on the short notice assessment program. I think that's a great additional improvement to the way we go about accreditation in this country. I want to come back and ask you about global trends in QI and health service organisation accreditation in a moment, Karen, but we'll keep working through some questions for now because we've got quite a few. Lovely question here from Terria Dawson from the Health Issues Centre in Victoria. And there's a related question, so I'll blend the two of them together. So Terry is asking, consumers engaged in health services are also invited to be part of accreditation processes. Is this useful to consumer assessors, and how do assessors engage with other consumers? And it's a related question here. Do the assessors ask to speak to consumer representatives in health services without the organisation staff present? So a general question there, I guess, about how do accreditation teams engage, and to the extent do they engage directly with users of services at the service level?
I can answer from my most recent assessment, if you like, and it always depends on what the consumers or the Consumer Advisory Council is happy with. I've had 10 or 15 consumers around a table at a morning tea often, so it's very informal. So people feel like they can speak to a couple of assessors at the same time, and we sort of go around the room and we talk to as many consumers as possible on a particular council. I've had telephone conversations with consumers who wanted to talk to the assessors because they knew the assessors were coming in a week's time or 2 weeks' time, but they weren't actually going to be in hospital and therefore wanted their opinion heard. So I've taken telephone calls as well. And every time I go around a clinical area, an outpatient area, I always make sure I just randomly stop and I ask the staff with me, can I just speak to a couple of consumers? And I might sort of point to a couple of people that are either awake or are sort of looking in my direction, so that I'm not getting given a consumer that they've sort of not pre-prepped, but I just want a random allocation of a consumer, so I can actually speak to somebody who can give me open and honest, their open and honest opinion about the care and treatment that they have been receiving. So everybody's different, but I know every individual assessor tries to talk to as many consumers as possible while they're on assessment.
Yeah, that's absolutely, Ros. That was certainly the case, and it's probably more so the case now since I've finished. That's what occurs. I mean, I remember, the relevance. I mean, the best indication you can get from a provider when the assessment team arrives on site is, and you're going through the schedule for the week or however many days you're there, and for the coverage of standard 2, it's absolutely, I mean, the best providers will say, look, we've scheduled these times, the Consumer Advisory Council that we've set up, or what other mechanism they've got for engaging consumers in the design, delivery and development of care, are available at these times. It's part of the schedule. It's sort of scheduled in. They leave the room. They're quite happy about the interaction to occur, as Ros says, randomly, as assessors walk around, visit, see the service, see all the service units, all the service delivery points, and have the opportunity of having conversations with people as almost like a casual conversation that is actually important in terms of gathering information, but not orchestrated in any way, and certainly is comfortable from the consumer's point of view in terms of having that sort of conversation with an assessor on site. So there's a range of opportunities for that to occur. As Ros has indicated, meetings of 12, 15 people around the table for an hour, 2 hours, talking about the consumer experience is certainly a formal part of the agenda, and that's absolutely essential. But all the informal opportunities are there as well, for as long as the assessors are on site. And I think that is another sort of, you're able to maximise, I guess, the inputs that you can get from a variety of sources by doing that. So,
and I think it's really important, Leanne, to actually have that informal time with consumers
as well
and
as
random consumers, because they will just open up and they will tell you everything, warts and all, which is great. And you listen, and it's, sometimes they want to vent, that's fine. But often you get some very valuable information about the service that's being provided within that organisation. And you can go back and you can talk to the staff about that as well.
Fantastic. Well, you've got the thumbs up there from Terry. I think she's very satisfied with that answer, so that's good. I wanted to come back to you, Karen. There was a report, and it sort of seemed to slip out, by the OECD, published in December last year, and it was looking at the extent to which patient voice is embedded in health systems across OECD countries. The top level finding was really that, with a few exceptions, patient voice in terms of patient participation in all the things we're talking about here, improvement, policy development, service design, is pretty weakly embedded. That was their, headline overarching conclusion. So, Karen, given you do run a global business too, I was just interested in some reflection on that from you, but also just some thoughts from you about what are some of the global trends in quality improvement and health service organisation accreditation with respect to consumer involvement.
Fantastic. Thanks very much, Leanne. And I think, one of the things that we have in Australia as a very good strength is, as Ros was saying earlier, having the partnership with consumers embedded across a set of national standards is a huge achievement. And I'm very proud to have been involved in that development process early on in another role. And I think, what we see is that stands us in good stead in Australia. If we compare that with other countries around the world, we don't always see that level of integration. We see it a bit more as an add-on. And so I think that's probably one of the key differences at ACHS through our international work. We've just developed a focus on standards for patient-centred systems, which we will be using with our international members, because the Australian standards are for use within Australia, and we want to make sure we've got that Australian sort of approach to what we're seeing happen globally. And then the second part of your question, more generally around trends and what are we seeing. It's been an enormous time of change in the last 2 years, but I think we're seeing that there are different approaches in terms of models of care and what can be applied, and consumers are really driving a lot of that, which is fantastic. You know, we're seeing the digitisation of a whole range of services that could really have always been provided in a digital manner, and then we're seeing the challenge of making sure that they're still safe and there's still quality health services. So, you know, the consumer voice is changing as well. You know, we are seeing a lot of people who have a combination of digital experience and health experience in healthcare services. And so I think that'll be one of the challenges going forward in terms of safety and quality, is that the delivery mode and the access route is going to be changed, and hopefully for the better.
Yep. Thank you for those reflections, Karen. I'll go to one more question, and then we've got questions from Hamza, which is a lovely segue to you, Lena, because he's really wanting to know the pathways and training for consumers to undertake accreditation. And by that he means training to be assessors. So we'll come to that in a minute, Hamza. Just one more question, I think we'll pick up from Helen. Helen Mees, she's keen to hear about the differences that short notice accreditation brings, especially in hearing from consumers as part of that process, the sort of, you know, unannounced approach.
I haven't been on a short notice assessment because currently with COVID-19, I've been trying to do virtual assessments instead of face-to-face assessments. But from other colleagues that have done short notice assessments, they said that it has been fantastic, because for the very same reason that we go and talk to as many consumers as possible, they just pick random consumers and they speak to as many as possible. There's no prep time because the staff didn't know that they were turning up. So they said they get some fantastic responses about what could be improved, the care that they've been given, and, you know, just the organisation in general. So I think short notice assessments, in my mind, if I was still running a healthcare organisation, I would embrace, and I think it's the way of the future.
All right. Well, look, we might segue now into Lena's presentation. She's going to take us through the questions that Hamza was asking about how do you go about training, and what are the sort of upskilling pathways to becoming a consumer accreditor or a member of an accreditation team. So over to you, Lena.
Thank you, Leanne. Can everyone hear me? Yes, I'm going to just share my slides for this session as well. And just to check if everyone can see the slides as well. Yeah, okay, good. So my session is going to look at the roles and responsibilities of consumer assessors. As both Ros, Mark and Karen have mentioned, the national standard to partnering with consumers is really not just the standard that consumers have a role in, because there's a role for consumers embedded throughout all the 8 national standards. And that's why it's so important to have consumers who have a voice and also are well represented on the assessment teams. Consumer assessors, the expectations at assessment are that they understand quality and safety principles, know about the best practice contemporary health service delivery, be actively involved in different ways in consumer activities and partnerships, and also have knowledge of accreditation processes and requirements. Most of these would be covered in the ACHS Assessor Competency Training Program. Apart from just being an assessor, consumers also can participate and contribute to many other ways for the health service delivery, such as providing feedback to healthcare organizations about safety and quality. And that could be being interviewed about your experience in various committees, or even as a consumer, or your involvement in the organization's improvement processes. I think that was part of what was discussed just before about not just the lived-in experience of care, but also looking at, from your perspective, the participation in as a carer as well. Participating also in the review of health service organizations' safety and quality systems, just separate from just the assessment itself. And also being a consumer representative on the various committees that health service organizations are encouraging very proactively. Also for ACHS, we really encourage and welcome consumer input into our assessor education and training programs. And we've done that in conjunction also with the Consumer Health Forum, and having representation on our training programs for our assessors. How do you become an ACHS assessor? Basically, on our website, we have the ability for you to click on the link of Join Us as an Assessor, and there will be a template that pops up for you to enter your details, just minimal, as a form, and it comes back to ACHS, and what happens is we'll send an email with information on the next steps, and also an application package which will contain a copy of the role description and expectation statement for you to consider. In relation to the commission, because the national standards are the commission standards, and ACHS is one of the accreditation agencies approved to assess to these. The commission requires that there are 4 mandatory modules for all applicants before they can progress into the assessor training program. And these are all online modules, but they are an orientation program to the national standards, 2nd edition. They think it takes estimated about 40 hours for completion. Also a core cultural learning module, which is the Aboriginal and Torres Strait Islander Foundation course. And then a colonoscopy care standard online module, and also infection control modules. There are 4 of these. These are all online, and these are part of where the Commission's thinking is that the consumer assessor role is not just about standard 2, but across all the standards. So these provide some foundation background courses into preparing all assessors in general to assess to all the standards as well. The program structure, it's a 3-day assessor competency training program. We call it the ACT. And from the completion of those 4 mandatory modules by the Commission, we can then take in assessors based on what our gaps assessment needs are as well, and the qualifications. And the 3-day program looks at simulating assessment of a healthcare organization. So there's all the requirements for what an assessor would have to do on site with teams as well. We have small teams, and we have experienced lead assessors as part of the presenters at these training programs. They're a blend of didactic and interactive sessions. So presentations and group work are really the fundamentals of this training, where you will be put into a mixed multidisciplinary group. And so we won't have just all one type of assessor for the training program. As Mark mentioned, we have lots of peer review assessments, and therefore it's assessors from all different backgrounds forming part of the team, and this program simulates that as well. So you'll have the lead assessors mentoring you throughout the program and providing formal feedback on the progress throughout the 3 days. And once that is completed with the 3-day program, there will be a successful progression to the next stage of training. The next stage of training will be an actual training assessment. So pre-COVID, these were all on-site assessments for training assessments, but we have, in terms of with COVID, had a blend of hybrid assessments and also virtual assessments. So depending on how it pans out, you'll definitely be partnered with another assessor. You will not be left on your own to assess. You might be given also a small sort of number of action items to review and work with the assessor. And the formal feedback will be from the lead assessor, who might also be partnering you for different parts of the assessment. So that's the training assessment. And after that, if you still don't feel confident, there is an option for another training assessment, or either you would then advance to a novice assessment. So there are 2 novice assessments before you become a fully fledged assessor, if you want to call that. And the 2 novice assessments, you'll be a full member of the team. You'll be assigned as well specific standards. And all of this will actually be then put into the final report in terms of your contributions. You'll not be left alone again during the novice assessments. You'll have the mentorship of the lead assessor who will oversee you throughout these 2 novice assessments. In terms of other support that ACHS will provide, apart from the support at assessments, there are annual mandatory training days where, again, pre-COVID, we would go to every state so that we would have a face-to-face with all our assessors throughout Australia. During COVID, we still managed to have our annual mandatory training days, but they were all obviously virtual, but still a great opportunity to maintain that connectivity with all our assessors. Other support, as I mentioned, feedback from lead assessors. We also have access to extended lead assessors, and these are professional lead assessors who are in all jurisdictions. So in every state, you could reach out to them. We also have the Assessor Division team at ACHS, who you can just call, connect with to ask any questions. There are also monthly optional Zoom meetings for updates and interaction. These are just optional if you want to connect, if you have questions and want to participate. And we also have an assessor newsletter to connect and to just update all our assessors with information about what ACHS is up to. What we have as well is also a dedicated assessor portal on our ACHS website. And on these, we have resources in terms of advisories from the Commission, fact sheets from state advisory committees about if you're going into a state, if you're from New South Wales, you're going into South Australia, there will be information about what are the requirements for that state to help you. And also there's access to information about what types of organization, the profile of the organization you're going in to assess as well. There are also sample reports for you to review as well to help you on your, to refresh about in terms of gaps between assessments. So other information that we might require would be current criminal record checks and police clearance. We require that for all assessors. If you're working with any assessments for children, there will also be the working with children's check. At the moment, we also have a requirement to comply with COVID-19 requirements such as vaccination status, and also whatever the health service that you're going into might require. As I mentioned, the annual mandatory training is a requirement, and also all our assessors are required to register annually to ensure that they're still maintaining currency of their training programs, and that they qualify still to be assessors. So any further information you need as well, just visit our website, connect with our assessor division by email, or contact Karen Edwards, who unfortunately isn't here, but that's the landline to the manager of the assessor division. So thank you for this opportunity, and we really hope to welcome you on as with your applications. I'll just stop sharing my screen.
Thanks, Lena and Karen. And we will make these slides available to people who've been on the webinar. There's some and I think these are important to just bring out for you. There's some quite practical questions in the Q&A here. I'll just bundle them all together, and you can probably just take them one by one. One from Philip: are there any out-of-pocket expenses to becoming accredited, or will this be fully covered by ACHS? Assume there's arrangements that could be put in place if LHDs are sponsoring consumers to become accredited, that is cost might be met with them. So the cost question is the general question. From Maureen: do you need a high education to be a part of this, or what other sort of skill sets do you need? Is the training program offered in all states? And another one pertaining to cost: it's a high time commitment for the training. Is there payment or support for any of that?
It's a lot of questions.
Yeah, so out-of-pocket costs for consumers, and remuneration for time spent, that general theme.
Yes.
Yeah.
So in relation to being accepted for the ACT, there isn't a remuneration for that, but we pay for the assessors, because for the applicants to usually we have it on site, the training program for 3 days. So from whichever state the participants come from for the 3-day training program, we bring them onto the ACHS office for the 3-day training, and we pay for the accommodation and also the flights. And once the novice assessments have been completed, the assessors can apply for an honorarium, and then the honorarium status would be payment for assessors when they become fully fledged assessors.
So the assessment is paid for, so there is a fee that assessors receive for that process. We do, outside the consumer sphere, we do also have healthcare clinicians who are released by their health service to do peer reviews, and they do that gratis. But for consumers, they would be paid for the assessment. Yeah.
Thank you. That's clarified that. Right. Okay.
And the state, there was a question about state.
Yes. Is the course available in all states?
So as I mentioned, pre-COVID, we would be bringing everyone to Sydney for the 3-day course together with our lead assessors and in the office, so that they also have the opportunity to meet the different personnel, the different staff at ACHS as well, because they are basically, they become ACHS ambassadors as well and part of the family. With COVID, we haven't had an ACT yet, so we're hoping that maybe the next one that we might have around mid-year would be where the travel is open to everyone, and we can bring the different from all over Australia back into Sydney again.
I think, Leanne, it's probably also worth mentioning that something that Lena mentioned early on, which is the first step in terms of training, is run through the government. That's run through the Australian Commission, and that's all online. So that's their requirement, not our requirement, but that's really the first benchmark. You've got to get it through that first. Yeah.
Thank you, Karen. That's right.
Fabulous. Okay. Just one final question for Katrina, and then I just wanted to get some closing remarks from Ros and Mark. did you, sorry, you got your hand up, Ros, was that?
Oh, yes, I just wanted to say if any consumers were interested in doing the training, I just want to let you know that it is a very well-run machine. When you are assessing, there is an incredible amount of team cohesiveness. We are all there to ensure the best interests of the patient, consumer, family, carers, are paramount in all our minds. So you are never alone. There's always other junior or senior assessors there, and we just support each other through the whole journey, every single assessment. So please don't feel like you'll be thrown in the deep end, because you won't. You will have a lot of support and encouragement along the way.
Yeah. Thanks, Ros. Just a final question from Katrina. Do you apply first for an assessor role or then undergo the training, or the other way around?
What you would do is actually, as Karen mentioned as well, you have to first complete the 4 modules, online modules from the Commission, because when you go in to apply for to become an assessor, the questions will be, have you completed the Commission's modules? It's the rules set out by the Commission.
That's in effect a prerequisite. Yeah. Yeah, great. All right. Well, look, we're coming to our last 5 minutes. I'd just like to close off really by asking, going back to Ros and Mark, just to offer a reflection on a positive experience where as a result of, your role, not necessarily directly, but where can you give us a mini case study or an example of where you have been involved in an accreditation exercise and you've seen, a change or a shift in that health service that really sort of rewarded and motivated you, and just a reflection on that?
I'm happy to start. My recent assessment that I did, it sounded very small, but at the time it made a huge difference to those patients. And it was as simple as there was a beautiful day room for the patients that were having cancer therapy, but because it faced west, a lot of the complaints that they had been receiving was about the heat in the afternoon, and the air conditioning was just not cutting it. So the patients and their families and carers were saying that it was incredibly hot in the afternoon. So after speaking to just a couple of consumers in the morning, by the next day, the health service organisation had decided they were going to put some tinting on those windows to cut out the heat going into that room by at least 50%. And that was just in a day. So I know that's something small, but, from, acorns do big things grow. So it's important that even the little things are important to a lot of consumers. And I've seen, beautiful cancer buildings that have been built in conjunction with consumer input, from the start, all the way through to the commissioning. And I've seen the data showing, 35% satisfaction rate with the service initially, up to like a 98% satisfaction rate after the building had been commissioned and, 6 months down the track. So I've seen all gamuts of small improvements to really large improvements, and that's all had consumer input.
Mm. Similar experience. I mean, one of my examples is from a mental health clinic, metropolitan-based specialist psychiatric facility, inpatient psychiatric facility, and the opportunity to talk to patients there, people, residents, clients, consumers in that setting, and dealing with the issues that they are dealing with, and still wanting to have an impact on their environment for the hopefully short period of time they're there. But you're talking about an average length of stay of probably 6 to 8 weeks, probably on average. So a significant period of time. And I've seen so many examples where they have been able to, as a result of our involvement during the assessment process, they've been able to open up lines of communication with the practitioners, the allied health staff, the treating psychiatrists and other mental health professionals in working with them to actually enable their recovery by amending the environment that they're living in and that they're receiving their therapy within. So lots of examples around that, from artwork classes, activities, outings, group outings as well, rather than just not just sitting around, but rather than the usual regimen, which is in terms of therapeutic settings, is group therapy sort of sessions that are the primary means of therapy delivery. Look, if there's one thing I'd like to emphasise for those that are thinking, and there's a lot of interest, I'm seeing, you know, a lot of interest pop up about people wanting to explore the possibility of being a consumer assessor. Bear in mind, there's a whole range of health environments that ACHS accredits. And I mentioned mental health just then, but a whole range of primary healthcare, hospitals. It's not just hospitals, there's small rural, regional hospitals and health services, community health centres, primary health centres that are out there in a whole range of locations. And really, that's the essence of what we're after here, the diversity of experience that consumers can bring to the assessment process applied to those sorts of settings really is what it's about. So I'd be encouraging everyone that's sort of even just thinking about it now to actually explore the possibility of becoming a consumer assessor.
Thanks very much, Mark. Well, I think, as you say, we've certainly got comments in here of people saying they're going to follow up on the training. So I think we've inspired a few hearts and minds with this webinar today. So I would really like to thank Karen, Lena from ACHS, and Ros and Mark for their time and their insights today. The reflection I have, in 2018, CHF published our Shifting Gears white paper. And in that white paper, we talked about the many and varied roles that consumers can have in the system, back to that OECD report about how do you embed patient voice. Sitting at policy tables and on national committees is just one way of doing that. I think what we've seen today is you know, how impactful a role consumers can play in training and becoming part of accreditation teams, because at the end of the day, policy frameworks and good policy is one thing, but quality improvement around safety and quality in services on the ground is where the change really matters and the consumer experience really matters. So I think consumer assessors, I hope passionately we're going to see more of them in the future. And I think it's an example of the sorts of many and varied roles we talked about in that white paper. So thanks, everyone. We've gone a little bit over time. So we'll follow up with answers to unanswered questions that we had, because we did have many, and the slides. And I'm sure Lena and Karen are available to answer any follow-up questions, as is Rebecca from the CHF team. Have a lovely day, everyone, and stay safe. Thank you.
Bye, everyone. Thanks,
Thank
Leanne.
you, everyone.
Bye.
Thank you.
Bye.